Hi, I'm Dr. Robert Moore from Awesome Chiropractic, and today we're going to talk with you about vertigo. Vertigo is a problem a lot of people have with dizziness. The room is spinning. Some people are nauseous, some people are vomiting, there's ringing in the ears. There's a whole bunch of problems people have with vertigo. Neither one of them's fun. It's not a good time for people. I myself have had vertigo as a result of a concussion, and I can tell you it's not a good time. So I want to talk with you today about vertigo and upper cervical chiropractic care, what we provide in our office. There's several reasons people get vertigo, and one major reason in people under 50 years old is a head injury or a whiplash. If you think about this, your head is like carrying a bowling ball, and in a whiplash or head injury, you're throwing that bowling ball in every direction. So that causes a lot of tension on the brain stem, on the neurology, on the brain, and specifically the 8th cranial nerve, vestibular cochlear apparatus. All right? Some people get vertigo as there's sign of severe colds or illnesses. Aging is a factor also, and that goes with the otoliths and the canals in the ears. And then there's also ototoxic medications. There's medications that will actually aggravate your inner ear and cause a lot of problems. And there's also people that suffer strokes. They have problems with dizziness and nauseousness and vomiting, a lot of aggravation. There's a condition called benign paroxysmal positional vertigo, BPPV. And that's a problem with the inner ear. Now I want to talk with you how specific upper cervical work will help people who suffer with vertigo. If you've had a car accident or whiplash, our specialty is the upper neck. We do a very gentle, very specific adjustment to the upper neck, the upper cervical spine, to realign the vertebrae and allow the trauma the opportunity to heal. With a malposition like this created by a whiplash or a head trauma, there's a lot of tension on the brain, the spinal cord, the nerve roots, and the blood flow to the head. We restore that balance. We restore balance to all of those areas of the body. The top 3 nerves in your neck are in charge of the health of your head. So if you'd like to have a healthy head, a healthy 8th cranial nerve, which is in charge of your sense of balance, then we want to make sure that those nerves are working good. So we work on the upper cervical spine to make sure those nerves are healthy and the blood flow to the head is healthy. All right? People with severe colds and allergies, that's again an immune system. And your immune system is based by your brainstem, and so a misalignment of vertebral subluxation up and through here will have a negative effect on your immune system, and you'll have a severe cold, severe illnesses for a long period of time, and that will cause a lot of aggravation. Aging, I'll tell you what, aging is a factor only if you don't take care of yourself. Aging is more of a matter of how long have you been messed up. If you have strokes, I've taken care of quite a few people who've had strokes, the vertebral basilar artery in their head or the carotid arteries in the neck, we make sure that those arteries are working at the best of their ability, and that you have the proper amount of blood flow to the head, and that everything can be as healthy as possible inside your head. And then the medications and the toxicity that cause the otoliths and the inner ear canals to get all messed up, that's a whole nother ballgame. We do work with ear, nose, and throat specialists when people have a problem with the canals and they have otoliths and the crystals in the ears all messed up. We do work with those people with the Dix-Hallpike testing and the Epley maneuver to restore balance to the inner ear canals. Chiropractic, specific upper cervical chiropractic, can make a big difference if you have vertigo. I'm Dr. Robert Moore at Awesome Chiropractic. You can visit us on the web at www.awesomedr.com for more information. But it's better yet, call our office up. You can talk to me, you can talk to my staff. We'd be more than willing to help you at 810-225-7246. Give us a call. All you have to lose is your pain.